Our next speaker comes to us from Eijkman-Oxford Clinical Research Unit in Indonesia. And Lenny Ekawati, please go ahead and you can start your presentation.
Okay. Good morning, everyone. Warm greetings from Jakarta, Indonesia. First of all, I would like to thank the organizing committee for inviting me to share one of our work titled A Formative Assessment to Define Malaria Risk Among Forest Workers in Aceh, Indonesia. Next slide, please. As malaria caseloads decline, a reactive case detection or RECD was introduced to detect remaining infections. This effort aimed to screen all family members and neighbors within 500 meters of the household of index cases. In that time, RECD in Aceh Besar district detected 6 secondary cases among nearly 1,500 individuals screened over 1.5-year period. However, survey data collected from those screens suggested that transmission may be occurring in the forest rather than in communities. Risk factors for malaria were being male, engaging in forest-related work, and staying overnight in or near the forest. Furthermore, Plasmodium knowlesi, a non-human primate malaria, was the most common parasite identified. The factors of Plasmodium knowlesi belong to Leptospirus group of Anopheles mosquitoes. These are generally described as forest-dwelling mosquito and may transmit two parasites to the forest goers. If transmission occurs mainly in the forest, current strategies of passive and active surveillance in communities could fail to detect infections. Next slide, please. This formative assessment aims to characterize forest activities, identify subgroups of forest workers at various risks and their mobility, and identify strategies for improving surveillance in these subgroups. In this study, we also assess the feasibility of implementing peer referral approach where index cases refer people who were in the forest for screening, and venue-based scheme where a study team goes to index cases work site in the forest and screen the workers on site. Next slide, please. Indonesia is an enormous archipelago nation. It stretches along equatorial line with over than 261 million inhabitants. Aceh, with a red circle, is one of 34 provinces in Indonesia and located in northwestern tip of Sumatra. The research was conducted in 4 study sites with high level of forest cover and suspected malaria exposure through forest work. Malaria transmission peaks from January to July, while August to December tend to see few cases. Next, please. This study implemented 3 formative assessment methods. First was focused group discussion, which targeted index cases and their co-workers, health workers, and forest communities who live in the non-forest and forest fringe area. Each FGD consists of 6 to 10 informants, and in total, the team successfully conducted 20 FGDs with 173 participants. Second was in-depth interviews, which targeted index cases who were not included in the FGD. Employers of forest workers, who in a local language we call them as toke, NGO, authorities, community health workers, and staff of health facilities. In total, the team managed 72 interviews. We also use community mapping exercise in both methods. Here, we ask forest workers and their colleagues to identify particular location where the forest workers did their activity. Next, please. Some researchers in this work linked to previous malaria study in Aceh province. In further collaboration with qualitative researchers, the questions in the formative assessment were composed. The discussion were performed by trained local interviewers in Acehnese language to explore more mobility patterns in the forest as well as behavioral exposures related to malaria. Audio recording were transcribed in Acehnese and translated into Bahasa Indonesia and English. A draft codebook was developed and 2 researchers used the draft codebook to independently code transcript using the qualitative analysis software called Deduce version 8. Thematic analysis were conducted on the transcription of participants' responses to interview questions and determine themes. By following grounded theory, the themes were explored, interpreted, and categorized for their consistency. Lastly, maps of work sites in each study site were developed based on the content of the discussion. Next slide, please. The study included 231 participants with approximately equal numbers across the 4 sites. Median age of male forest workers was 30 years, range from 18 to 56, whilst median age of other informants were 36 years old, range from 19 to 73, with more male than female. 41 individuals contacted declined to participate due to work activities in the forest, immediate family matters, uncontactable, and unwell on the assigned day of group discussions. Next slide, please. Treatment-seeking behavior is defined as sequence of action that taken by individual in responding to their illness. Many people, including forest workers, differ in their willingness to seek health assistance. Some are immediately ready for early diagnosis and expect proper treatment. Others probably only when in a great pain or in advanced state of their illness. Across study site, most participants perceive forest workers to be at high risk for malaria, but limited only for people who work and stay overnight in the forest and mountains, predominantly men with a much smaller percentage of children. At all sites, forest workers describe the presence of monkeys during daytime travel within the forest, most reported seeing long-tailed macaques. Almost all participants described that predominant malaria symptoms are headache, chills, and fever. Most of them were not using mosquito nets or repellent at night, working and sleeping outdoors at night, and lighting a fire to ward off mosquitoes when sleeping. Many participants believe that eating certain foods protects against malaria, and wearing charm stones was seen as protecting against mosquito bites. Next slide, please. Many reported that they tended to ignore symptoms or self-treat with medication they brought from local pharmacies. When malaria symptoms persisted, after self-treatment, the workers just visit a pharmacy and purchase the commercial brand of chloroquine without being tested for malaria, while some informants reported they seek care to a primary health center or presenting to nearest private clinic, often run by nurse or midwife. Other participants reported that forest worker consulted two traditional healers before going to the primary health center, particularly when they or their family believed that malaria was by an evil spell or by a bad spirit encountered at work site. Next slide, please. One of the primary barriers for seeking medical treatment among forest workers was the high cost of transportation to health facilities. Some participants perceive primary health center to have inconvenient operating hours. Among migrant workers, seeking treatment at primary health center was reported to be more complicated because they were not registered in the local health insurance scheme. A number of participants informed that forest workers avoided seeking treatment at primary health center due to fear of needles and misconception about injected treatment for malaria. Next slide, please. Agricultural activities were reported in study sites, in all study sites, and was small scale with work groups of 1 to 5 individuals. This group is getting bigger during planting and harvesting season. Farmers reported spending from a few nights up to 1 month in the forest and sleep in a simple huts. Logging activities comprise a bigger team of 3 to 30 men. Loggers were described as staying at given site for about 2 weeks until trees are depleted before moving elsewhere. Loggers who reside within Aceh typically sleep at the logging camp for a week at a time, while migrant loggers often remain at the logging camp for 1 to 2 months. Mining activities included both local and migrant workers. The local miners usually stay at mining camps during the week and sleeping near their mining site. Next slide, please. Determination of whether venue-based or peripheral-based surveillance were likely feasible to access forest worker was based on emerged themes. Agricultural workers and rangers were seen as accessible by peripheral because they often hail from the same village and tend to work alone in a small group. Venue base was considered as a practical option for occupational groups that tend to stay overnight or work at well-defined work sites such as miner. Next slide, please. Next slide, please. Next. Yeah, so this map show the estimate location, distance, travel time, and types of forest activities according to content of focus group discussion and interviews at each site. In the first site, the forest workers informed that the predominant activities in this area was mining. You can see them in blue dots with 11 identified sites. Among those, 2 active sites consisted of approximately 100 workers in age. Of note, females are forbidden at the mining camps because they are thought to harbor bad luck, which would preclude female nurses and other staff from participating in venue-based surveillance in mining area. Agricultural activities in orange dots were located both in forest fringe and deep forest. Loggers in this area, represent with green dots, consist of gathering rattans, and this activity occurs throughout the years in the same areas as logging. In the second map, cattle ranches in forested areas were reported. They are located in the forest fringe and collectively owned by villages. Residents take turns spending the night at the ranches to guard the cattle, generally in groups 2 to 3 family members from the same household. In this area also, forest rangers work in a group of 4 to 6 officers. They routinely patrol their remote posts located around 6 kilometers from outermost villages for 2 to 3 hours at night. Next slide, please. This study is the first to describe and characterize forest workers and their malaria risk in Aceh province, where they engage predominantly in logging, mining, and agricultural activities. The identified diverse groups of forest workers in Aceh are potentially exposed to malaria through forest work. Passive surveillance and household-based screening may underestimate malaria burden due to extended stays in the forest and health-seeking behaviors. Adapting active surveillance to specifically target forest worker through worksite screening and or peripheral appears promising for addressing currently undetected infection. Next slide. Last but not least, I would like to pass my sincere gratitude to all study participants, my senior fellows and mentors at the Eijkman Institute and IOCRO in Jakarta, our international research collaborators from University of California, San Francisco, provincial and district health offices, UNICEF Indonesia, and our Acehese interviewers. Last slide, please. Terima kasih in Acehese, and thank you all for attention.